if I'm starting to get angry, I start to, feel tight in the chest, I get red in the face, my voice starts to, have a bit of a sting to it. And recognising that and realising that that's not helpful for anyone, it's not helpful for me because I'm getting tense and more anxious. And if I'm showing my kids that, that's going to fire them up and trigger them. Yeah. So I have to learn some self-regulation in order to help them regulate. So what I would need to do is, take a few deep breaths, maybe close my eyes for a minute, sometimes actually walk out of the room. So if one of my children, one of the best strategies is if one of the younger children particularly is having a tantrum and a meltdown and it's safe, I will...
Hi, I'm Dr Jodi Richardson and this is Well Hello Anxiety. In a world that often moves too fast, we're here to pause, breathe and understand anxiety together. Each episode will explore practical strategies, share honest conversations and uncover the science behind anxiety and well-being, all while creating a space where it's okay to not be okay. Let's continue this journey together. Welcome back to another episode. We are in for such a treat. I'm in the studio today in person with Dr Lexi Frydenberg, and she is a pediatrician who has so much experience. She has over 20 years experience working clinically between a large pediatric hospital here in Melbourne and the Victorian Children's Clinic. Lexi not only is a general pediatrician, but she is also an educator, a radio host, a podcaster, a TV presenter, a speaker and a writer, and a mum of 3 teens. And she's so passionate about adolescent mental health, development and well-being. And it's just such a treat, Lexi, to have you here in the studio. So welcome and thank you.
Thanks so much for having me, Jodi.
Lexi and I met at an event and straight away I'm like, please, will you come on the podcast as a guest? So, Lexi, you've got so much expertise and experience working in the clinic with families, with young people. And we know anxiety is just such a huge challenge for families all around the country. And I say families because it doesn't just affect the child. There's so much, anxiety has effect on everybody who is involved in the family. And so what are you seeing in the clinic? Can you help parents who are listening to get a bit of an understanding about what your role is as a paediatrician and who's kind of coming along to see you for help to start with?
Yeah, thanks, Jodi. I've been working in paediatrics now clinically for, I think, 25 years in the clinical setting. And the presentation of anxiety has changed over the years, and particularly post-COVID here in Melbourne, where we had extended lockdowns, which really did have an impact on our children's and adolescents' mental health. We are seeing more anxiety, and we're seeing it present quite early in younger kids. So it used to be 10, 15 years ago, we'd have a child or parent come in and they may have awareness that they've got anxiety. They may say, I've got so many worries, I'm really finding it hard to get to school, I can't sleep at night, I'm scared of, going to parties, etc. But many children aren't able to articulate what they're experiencing. So we would also see a lot of children in clinic who presented with what we call somatic. So issues that affect their body. So they might present with tummy pain or headaches or experiences of feeling dizzy or lightheaded or sweaty, but they may not have put those symptoms together with what is happening, and they may not have realised that that was anxiety. So we've seen kids who present with these, body symptoms. We see kids who can articulate that they've got worries. And one of the big things we see in paediatrics is behavioural challenges. Yeah. So particularly with the younger kids, parents would bring their kids to clinic and say, I'm really struggling with my child's behaviour. They are just, triggering all my nerves. I'm really finding it hard to cope. I can't get them to school. I can't get them to bed. I can't, manage anymore. Help me with their behaviour. And one of our jobs as paediatricians is to help the family look at the behaviour and how to manage that, but more importantly, look at what's upstream, what is actually triggering or causing that behaviour. So they're the big 3 things we see in clinic that might present as anxiety in children and teens.
And how young are we talking? Because we know that the statistic that I've referenced before is that 50% of mental health challenges that adults experience have been experienced by the age of 14. And so how young are you seeing young people coming with anxiety?
Yeah, we don't have the data yet about what's happened over the last few years, post-COVID, etc. But it used to be sort of the tweens, the 10 plus, and now we're seeing kids younger and younger. So they will present very differently. So a little child who's anxious might present with behavioural challenges or tummy ache, headache, etc. And an older child might present, with school refusal or, locking themselves in the room and avoiding certain things.
Yeah.
But we're definitely seeing it in the, pre-tweens now.
Yeah.
And I think that's really hard for families because both for the child who's experiencing it, but also for parents, because as parents, as you know, we just want to help our kids. We want to protect them from pain. And, anxiety and panic can be really uncomfortable. So for parents to see their children who are really young experience something that's really uncomfortable is really challenging.
It really is, and it does affect everybody. It creates anxiety in the parent. What's the next day going to look like? Are we going to have the battle about school, or is my little one going to be, just the worry about what is this all going to amount to? Because it's hard not to look ahead and think, well, we're having these challenges now. How is this going to affect them across the coming years and across their life? And
I think it's really important, Jodi, to remember though that having worries and fears and anxious thoughts is really normal across every developmental age and stage. And we all have them, and it's a good thing. It's our protective brain. And, having a child who's, having some anxiety in the primary school years doesn't necessarily mean they are going to have a generalised anxiety disorder for the rest of their life. So it is a fluid, experience. And I work very hard not to jump in and label children with diagnosis. I don't want to over-medicalise things.
Yes.
Because I find that once, particularly with children, once they've, got a label or a diagnosis, or some parents, then everything becomes about that label and that diagnosis. And I think that can be a real challenge with anxiety, because once you start feeling, I'm that anxious kid, I'm the kid with anxiety, I'm the kid who can't go to parties, I'm the kid who can't go on holidays, it becomes a bit of a self-fulfilling prophecy. I have had anxiety myself, and one of the hardest things I find is what's called anticipatory anxiety. So anticipating the event that has previously caused me anxiety. For me, it's a bit of travel and being away from my home.
Yes.
And I think once you start going, I had it last time, I'm an anxious kid, this is going to happen again, you can really ruminate and, become that person. So I spend a lot of time with families talking to them about educating themselves what anxiety is, how it's a normal response, how we all experience it, but, when is it gone too far and when to get help. But also trying not to jump in with labels and pigeonhole a child into one particular area, because all our children and all our adolescents have so many strengths. We have to focus on those things as well. But I'm very proactive. As a pediatrician, we like to problem solve and help families move forwards.
Yeah.
So I think it's important to validate and discuss what a child is going through, but a really important step is how to move forward.
Yeah.
And I think that's where a lot of people get stuck. They get stuck in the conversation, the labelling, the woe is me, woe is my child, we've all got anxiety, this is really hard. And it is. We've got to validate that. But we've got to go to that next step. How do we make our children be brave, move forward, support them to be able to live a life that we want them to live?
Yeah. And how would you start that with the family? How would you start that conversation? Or what would be one of the first things that you would teach a family? Is it about the language that they're using? Is it about the way that they're responding? We know that when parents accommodate, for example, if a child's feeling really, really anxious about something and the parent supports complete avoidance of that experience, then we know that that will drive anxiety higher over time. So for the family who are listening, who are thinking, yes, I really relate to this, and yes, we're in the thick of this right now, but we're waiting for a pediatrician appointment, or we're on that journey, how would you start to turn the focus to moving forward? Because, the whole podcast here is called Well, Hello, Anxiety. It's like, well, hello, anxiety. What are we doing today?
Yeah, we've all got it. We all experience it.
Yes.
Now what?
Come with me. Let's go. Yeah, that's a mindset shift, isn't it, to begin with?
Absolutely. And I think a lot of parents, first, it's about recognising it. So if your child is coming with behavioural challenges or, other body symptoms, recognising what it is, having a conversation with the child when they're not in a heightened state of anxiety or a panic episode, because it's incredibly hard to actually have a conversation during that time. So I think recognition is important. I think education of yourself as parents and age-appropriate education for the kids is really important. A GP is a really good first step, and most people have a family GP or can get into a GP to start the conversation. But a lot of parents feel stuck while waiting potentially for a pediatrician, a psychologist, a counsellor, a mental health social worker. And there are a lot of things you can do. So there are a lot of resources out there online, and I would recommend parents look up some of the resources from Beyond Blue, Reach Out, the Brave program. There's a lot of information out there that is directed towards parents as well. But I think as a parent, if you have a child who's going through something challenging and they're anxious, they can articulate it, or you recognise what it is, I think our role as parents is to be there for them, to not necessarily fix it for them, but to stand there with them, sit there with them silently in the room if they're having a moment, and be there for them when they're ready and if they're ready to talk.
Yeah.
So I think it's important to recognise what's going on, label it or validate it if you can, make them go, yep, this sounds like, it's anxiety. Do you think that's what it is? And that's okay. Sit with them through the hard moments. But then at other times when you're having conversations driving in the car, or when you're, going for a walk together, when they're not in a heightened state, talking about what you can do together to help them. Some of those things can be what to do in the moment. So if a child is having a panic episode or, getting that stomach ache, headache, sweatiness, what you can do. And a lot of that's related to sort of breathing exercises, which we can talk about. There's some labelling games where you can, label everything that you see around you. So if you're walking, you can say, I see the green grass, then I see the grey concrete, then I see the brown fence. And it's just bringing you back to the present rather than your head. So really some strategies what to do in the moment, but then have a conversation about what is the anxiety stopping your child from doing. So what functional impact is it having for your child and for the family, but particularly for the child? And how can you work as a team to help them move forward? So if you want, we can talk about a few examples, and we can talk about what you've experienced work and what I've experienced work.
I'd love that, because I think the practical examples can be really useful. And I've got an example coming to mind of a child who is experiencing a lot of anxiety around food, and is the variety in what they're eating is getting much smaller. There's anxiety then about leaving the house and going and being at someone else's house, because depending on what food might be around, and that's a really big issue, and it's making the world smaller, because it's hard when that anxiety feels so dangerous and so overwhelming that the retreat is one of the common things, isn't it? That's the avoidance. And
absolutely. And I think you're right. We're seeing food issues become more and more apparent as a sign of anxiety. So eating disorders escalated exponentially during the pandemic and have continued to do so. But we are seeing a lot of younger kids And there is a condition called ARFID. I'm not sure if you've heard of it.
I have heard about it, yeah.
So what happens when a child starts restricting their food? They might restrict the amount, but often it's the type of food, and they might start getting nutritional deficiencies. Sometimes it's about the taste. They don't like the taste of the food. Sometimes it's about the texture. Sometimes it's about they don't like the food touching on a plate. And what tends to happen is, as you said, the amount and type of food just gets smaller and smaller. And parents worry so much about what food and how much food their children take. It's one of the biggest things we see in clinic. And I understand it, because you want your kids to be healthy, and nutrition is one of those important benchmarks of health. Yeah. But I think one of the challenges is trying to work out, is there a reason why your child has suddenly or not suddenly started to avoid certain foods? Have they had an experience like choking on a particular piece of food or vomiting after eating a certain food? So in a small number of cases, we can identify what triggered it and you can manage it. But as you probably know, Jodi, is most cases with anxiety, we can't find the cause.
Yeah.
You can't actually pinpoint why the child has changed their behaviour. So really it's about what can we then do about the behaviour. And I think it's important to set really small goals.
Yeah.
Sometimes you can do this alone as a parent with your child, but often you need help and someone to hold your hand through this process, because it's hard.
Yeah.
And so if you have a child who's really dietary restricting, having a good dietitian who understands this condition is helpful, or having a psychologist who's very familiar with this as well. But it's about baby steps. So it's about graded, gradual exposure. So say with food, if there are 4 or 5 foods your child regularly eats, continue on with those. Don't stop them. But make a decision and have a conversation with your child about trialling other foods. And you're not going to go from having 5 foods on your plate to going to a buffet breakfast.
Yes.
That's going to be overwhelming.
Yeah.
So you might decide with your child, what is the next food that you'll be willing to try? Is it a certain colour food? Is it a certain texture? And, it's about gradually exposing them to it. So the first few days you might just put it on the plate next to the foods they have. The next day they might get to touch it. The next day they might get to, touch it to their mouth. And then, eventually have a bite, have a few bites, and really reward the process. It's not about rewarding the end point that suddenly your child can eat broccoli. It's about rewarding the process. You've got to be realistic. You can't reward them with, huge amounts of money every time they do something, because you'll end up broke. But it might be, okay, I just want you to sit here with the broccoli on your plate. If you can do that, what's the reward you'd like today? It might be a sticker chart, depending on age, a lucky dip. It might be 10 minutes on an iPad.
Yeah. But
it's rewarding the behaviour of sitting there with the broccoli on the plate. And then as you gradually build it up, once they eat the broccoli, it's like, this is great, you've got this, keep it in their diet. And really, a child needs that sense of achievement.
Yes.
They need to have achieved something. It doesn't have to be the end point. Eating the broccoli, even having it on the plate, is an achievement. So celebrate the small wins, do it gradually, and get the right help if you feel like you're not winning.
Yeah, I love all of what you've just shared. The small steps, and if the first step feels too overwhelming, break it down, and you can include the child if they're old enough in kind of like stepping it out. Like you said, sometimes you need the support of a professional as well to help you stay the course. And
absolutely, and I think reflection time for parents is something we probably don't get enough, time in our lives to do. So if you've got a chance to reflect with a partner, a parent, a friend, your own psychologist if you have one, what's worked before and what hasn't. So all our kids have anxiety. I had, kids who were scared of going to the park because they were scared of dogs. I had a child who was scared of face paint, so parties were a real challenge if there was going to be a clown. Scared of the hairdresser. I mean, it's endless when you have children. There's always going to be worries. But think about a time where your child has managed, with your help, to work through something before. and what worked that time, and then translate it into the thing you're trying to achieve this time. And remind the child that they've done it before, they can do it again. I think positive talk, both positive self-talk and positive talk from parents, is incredibly important.
I agree. And that confidence that we can have in our kids to sort of validate, I know that this feels scary and this feels hard, but also know that you can do it and we're here, we can do it together. I'm here with you.
We don't want to ignore kids and we don't want to ignore their feelings. You don't want to say, no, you're not anxious, just get to school. Like, that doesn't help.
Yeah.
Saying, yeah, I get it. Like, it's overwhelming after 2 years of lockdown to go back to school and there's, 100 people in your class. I get it. But sometimes we have to do hard things.
Yes.
And I know you've got this. Also giving them a sort of a plan what to do if things don't work. So they've got an exit plan. You don't want to plant a seed in their head and say, okay, if it doesn't work, I'm picking you up by lunchtime, because then often they'll go, okay, I'm going home at lunchtime. Yeah. But what are the steps they're going to take if your plan doesn't work? Who are they going to talk to at school? Who's going to ring you, etc.? And just because it doesn't work once doesn't mean you've got to stop trying. You've got to keep slowly building on it and reassuring and being supportive. And it's really hard as parents when we're stressed, anxious, busy ourselves.
Yes.
But I think, understanding what it's like for your child without helping them avoid a stressful, anxiety-provoking situation is the goal.
Yes, it is. And what you just said is so true. Sometimes we're so worried about them and we feel stressed because our own lives are full and we might be tired or sleep deprived and to calm ourselves and to try to share that calm. Can you talk a little bit about co-regulation and what that means for listeners who haven't heard that expression before?
Absolutely. So, yeah, I think the word regulation, self-regulation, co-regulation has really come into the vernacular of late. It's about how we regulate or respond to our thoughts or emotions. So with myself, if I'm starting to get angry, I start to, feel tight in the chest, I get red in the face, my voice starts to, have a bit of a sting to it. And recognising that and realising that that's not helpful for anyone. It's not helpful for me because I'm getting tense and more anxious. And if I'm showing my kids that, that's going to fire them up and trigger them. Yeah. So I have to learn some self-regulation in order to help them regulate. So what I would need to do is, take a few deep breaths, maybe close my eyes for a minute, sometimes actually walk out of the room. So if one of my children, one of the best strategies is if one of the younger children particularly is having a tantrum and a meltdown and it's safe, I will, instead of giving them time out, I'll give myself time out. Yeah. So just a few minutes, few seconds to go, get some fresh air, try to come down from my heightened angry state so I don't yell or act out or say something stupid. And then with a calm, quiet, if I can, voice, try and help my child come down from their really heightened state. Now, most of the time, as you know, if you have a child, particularly a younger child, who's throwing a tantrum, throwing themselves on the floor, head banging, yelling at you, they're not going to hear anything you say. Yeah. So that is not the time to have a conversation about the behaviour. That is not the time to say, Sally, it's really not good how you're behaving like this today. I'm really, really frustrated and I'm getting really angry. And, do you think this is fair to mum? This is not fair to mum. That doesn't help.
No.
So actually take a breath, walk away if you have to, and then come back. In the moment, help your child calm down. Get down to their level. If they like, from previous experience, if they like being touched, if they like being hugged, if they like being held, be there for them. You need them to know that you're there for them when they're not feeling safe and when they're really heightened. Once they've calmed down, at a different time, if they're old enough and developmentally appropriate, have a conversation with them about it. What was going on for you? What could have we done differently? What should we do next time together? So I think that's really important, not to try and have that conversation in the moment, but be available and be there for your child.
Yeah.
But I think one of the things I've been grappling with late, I don't know if you have as a parent, is, the concept of are we over-parenting our children? I don't know if you've had this conversation on the podcast, because it's a really fine line for us as parents. How much do we want to make it easy? We want to, probably all of us want to be helicopter parents and helicopter around our children and make them safe and secure. And I don't know if you've heard this term, the lawnmower parent. Have you heard it?
Yes.
I love that one. So when you actually mow the lawn in front of your children to make their life easier so they don't have to go through the weeds. So on one hand, as parents, I think we want to be, we want to protect our children and make their life easy, because there's nothing more difficult as a parent than seeing your child in pain. But we also know we've got to teach them that there are rules, that there are boundaries, that they've got to learn some skills for themselves, that we're not always going to be there to do things for them. Yeah. And we, can't problem solve every issue for them. We need to teach them resilience. We need to teach them coping strategies. We need to teach them to be brave. And what I'm grappling with, both as a parent and as a pediatrician right now, is, which way are we going as a society? I think, in the 50s, it was probably, be seen and not heard for children. And I don't think that parenting style particularly worked well. But are we going too far the other way and not teaching our kids some skills on how to cope in the real world? Because they are becoming adults and the world, can be challenging.
And we want them to be able to go out into the world and to face challenges and to have the skills to cope. I was the classic anxious kid who just always leaned on someone. I didn't have any coping skills, Lexi. I would always, even as a teacher, when I started my first professional career, I was on the phone sometimes to mum at recess, because I'd learned to, if I was worried about something or something felt hard, to lean on someone else for support. I didn't have it within me. I'd never been taught. And
I hear you, Jodi, but I would put my money on it that you had a lot of coping skills. You just weren't in touch with how to use them and when to use them. So I think everyone has coping skills. I mean, we look at a child, how they learn to walk. So they first learn to sit and they fall. Then they start crawling and they fall over. And then they start to walk and they fall. And, it's innate for us to learn, how to cope, how to then move to the next step. It's developmentally appropriate. So I would bet if I looked at, back at you as a young child, as a young teacher, you would have had plenty of coping skills. You probably didn't have the language to be able to articulate what your strengths or skills were. You'd probably not had those conversations with people around you. And you may have then become dependent on, one sort of avenue. What do I do when I don't know what to do? I'll ring my mum at recess. Yes. But you would have had a whole lot of other skills, but no one actually held a mirror up to you to help you realise what amazing skills and strengths you had. So I think, yes, we can learn one coping strategy and rely on that, and that's probably not ideal. But we've all got it within us to learn many coping strategies. Yes,
and it was after going through depression and realising that what I thought made for a happy life and what my experience of having all of that and still being quite miserable, that misalignment, I studied the science of happiness and I started to learn, and I identified my strengths and I learned new skills, and I had a great therapist, and I've learned and I had developed those insights into what I could do for myself and stand on my own 2 feet.
And I think one of the roles I, as a paediatrician, really try and get parents, particularly when they bring kids with behavioural challenges, is to try and find and discuss and say out loud their child's strengths. So when we have a child who's, particularly a toddler or a young school-age child who's really challenging, often the parents will come in and they're at their wits' end and they will say, you have to help me with this behaviour. I can't get the kid ready for school. They're throwing things all over the house. It's just so difficult. And I say, okay, we will talk about the behaviour and what to do. But let's talk about your child as a whole now. I want you and your partner to go home and write a list for me. Put a line down the middle. I want you to write some of those challenging behaviours that you want to focus on. And then I want you to write all the strengths that you can recognise about your child, all the good things, all the good moments.
Yeah.
And they say, oh, you know, that list is going to be really long on the behaviours. There are so many. And maybe not so long on the strengths. And I say, and they bring it back, and it often is. And I say, okay, well, we're going to focus on one or two of those really challenging behaviours, but I want you to spend more time on the strengths.
Yeah.
And even in our clinic room, we try and have a conversation about the child and what they're like on a good day, on their best day, and we try and bring out some of those strengths, because I think what we don't do enough as parents when we're busy is focus on a child's strengths. So I often say, catch them being good.
Yes.
I love that phrase.
Yes.
And, you know, I think overdo it. So for a few weeks, I give them a task of going home with their list of paper and saying, okay, we'll focus on the one or two behaviours that are challenging, because I know that's why you're here, and we'll talk about how to do that. But I want you to catch them being good 100 times a day. And I want you to say it out loud. And you might feel completely foolish for saying it, but I want you to say, you know, hey, Johnny, it was so good how you sat there for 2 minutes while I finished my coffee. And it was so nice of you that you actually bought me the remote control for the TV. And when you came into my room to give me a hug for no reason, that was just amazing. It made me feel so good about myself. And I just, you know, have this running commentary like you're watching the races. We've just had Melbourne Cup.
Yes.
But have a running commentary about all the good things your child is doing.
Yeah.
It's incredibly helpful for their self-esteem.
Yes.
And I think trying to find those strengths, find those light moments, find the joy in our children, what they're good at, what they, you know, their delightful moments is really important, because I think we can focus on those negative behaviours and the challenges so much. But we all want to feel good about ourselves.
We do. Lexi, I would love to continue this conversation. Will you stick around for another chat, and we'll put it out next week for a new episode?
Absolutely. It's been delightful.
Amazing. Thank you. Thank you for listening. When Lexi and I pick up again for the next episode, we are going to be talking more about strengths. We're going to talk about resilience. We're going to talk about who is the right practitioner for you to connect with if you are in need of some extra help with your family, and the different roles of a doctor, a pediatrician, a psychologist, the role of medication, so much more to come. So join us next week. We'll see you then. Thank you for sharing this time with me on Well, Hello Anxiety. Remember, understanding anxiety is the first step to managing it. Until next time, be gentle with yourself. Take things one moment at a time. Focus on what you can control, and know that you are not alone on this journey. If you found value in today's episode, please share it with someone who might need to hear it too. I'm Dr. Jodi Richardson, and I'll meet you right back here next week.